Hi, my name is Laprit. I'm student nurse over there, and doctor prescribed me to do your head-to-toe assessment. So can I do that?
Yeah, sure.
Okay. So can you tell me your name and date of birth?
My name is Shraddha Sharma and my date of birth is 15 June 2003.
Okay. So it matches with my record. So let me do hand hygiene and provide you some privacy. So first of all, we start with the neurological assessment. So can you tell me that what's your name?
My name is Shraddha.
Okay. Where are you?
I'm in the hospital.
Okay. So what time and date today?
It's 4:30 p.m. and it's Friday.
Okay, good. So patient is fully conscious and oriented with the time, place and person. So now I'm going to do Perla assessment. So thank you. Okay. So see the tip of pen. I'm moving towards you. This side. Thank you. So I'm done with the direct consensual test, and the pupil are equally round and reflected to the light, and there is a present of the accommodation. So can you repeat the words like sky is blue?
Sky is blue.
And can you smile for me? Okay. Can you lift your arm and close your eyes? Count 1 to 10.
1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
Okay, thank you. So there is not any presence of the slur speech and the facial drop, and there is the absence of the pronator drift. So we are done with the neurological assessment. Now we are going to do the cardiac assessment. So there is a sternum notch which is present over there, and if we are moving towards the right, there is a second intercostal space right to the sternum border. It's called the aortic valve. And if we are moving towards the left, there is a second intercostal space, and left to the sternum border is called the pulmonic valve. If we're moving towards down, there is a third intercostal space left to the sternum border is called aortic point. There is a fourth intercostal space, and left to the sternum border is called the tricuspid valve. If we're moving a little bit down, there is a fifth intercostal space left to the sternum border is called the mitral valve. There is a little bit left, there is a fifth intercostal space mid to the clavicle line. There is an apical pulse which I'm going to hear for a 30 seconds. Okay. The apical pulse is a 68 beat per minute, and the normal is a 16 to 100 beat per minute, and the rhythm is regular. Now I'm going to do the respiration assessment. Can you stand here, Shraddha? Thank you. Can you move? So now I'm going to do the inspection first. I'm going to check the expansion and retraction of the posterior chest wall. Can you breathe? Okay, exhale. So the posterior chest wall symmetrical bilateral. And now I'm going to do the auscultation. So firstly, I'm going to hear chest front chest wall. Can you move? Yes. Thank you. Thank you. You can sit. So there is not any cracker or any breathing sound is present over there. The breathing sound is non-labored, and there is not any like advertisanal sound is present. So we are done with the respiration examination. Now we are going to do the abdominal. Can you lay down? Yeah. Okay. So as you can say that there is not, first of all I start with the inspection. In inspection there is not any scar like discoloration, any scar or lesion is present over there. Now I'm going to do the contour assessment, and I can say that the stomach is the position of the stomach and the contour there is a flat. Now I'm going to see the symmetry. In the symmetry of the abdomen is equally bilateral. So now we are done with the inspection. Now I'm going to do the auscultation. So do you have any pain in any region of the abdomen? No. Okay. Now we are going to start with the lower right quadrant to the upper right quadrant, towards the upper left quadrant, towards the lower left quadrant. So the sound of there is a normal vowel sound is present. So now I'm going to do the percussion. It's again start from the lower right quadrant, upper right quadrant, upper left quadrant, lower left quadrant. So the sound, tympanic sound is present over there. Now I'm going to do the palpation. So it's again same, lower right quadrant, upper right quadrant, upper left quadrant, and lower left quadrant. There is not any kind of a mass formation is present over there. So now we are done with the abdominal examination. Can you sit? Now we are going to do the extremities and skin assessment. So first of all, can you tell me if you feel any pain on the like in the both extremities, upper and lower?
No.
Okay. So patient is not feel any kind of a pain, or I also don't see any kind of a deformity. Now I'm going to check the edema and the pressure ulcers. Do you feel any pain in the legs? Can you check? Do you feel anything?
No.
Okay. So there is not any kind of a like redness, edema, and any pressure ulcer or bruise are present over there. We're done with inspection. Now we are going to do the skin integrity test. So can I see your hands? Okay. So I'm going to check the turgor of the skin, which is good, normal. Again for the foot. So it is normal on the both extremities by equally. Now we are going to check the nails consistency and its capillary refill. You can see that the nails is pink, intact and non-rigid on the both hand. And can I see the thumbs? Thank you. So it's easily capillary refill is present on the hands. Now I'm going to check in the lower extremities. You can see that the nail color is pink, intact and non-rigid, and both on the foot the capillary is normal, good. And now we are going to do the muscle strength test. Can you lift your arm and push towards me? Okay, good. Now this push. Thank you. This side. Thank you. Can you put your, yes, put pressure? Yes. Now back. So we can say that the muscle strength is a 5/5. And now we are going to assess the pulses. There is a first carotid pulse which is present on the both neck, on the lateral side of the trachea and the middle of the sternocleidos mastoid muscles. So it is a equal bilateral, and if we see the posterior tibia on the both side, posterior tibia pulse which is located on the posterior of the medial medullaris, and it's also equally on the both side. And if we are going to assess the dorsal pedia, which is on the dorsal of the prominent of the navicular bone, which is also equally bilateral on the both side. So we are done with the assessment. Thank you for your helping, and we are done, and I will going to documentation all the assessment, and thank you.